Hi, Michael Salas from Vantage Point Counseling, and uh, I talk about this a little bit on my blog, but I thought I would also do a video on it because I think it's an important thing to discuss. As you know, or maybe do know, if you've looked at our blog or my other videos, I'm a sex therapist and a sex addiction therapist. Um, and so there's been a little bit of conflict between the two. And this has created a lot of important discussion about when there is problematic sexual behavior, compulsive sexual behavior. Does that constitute as an addiction? And there are differing opinions on that, and I talk about that a little bit in another video that you can watch on our YouTube channel about whether or not sex addiction is real. However, in this particular video, I wanted to take a little bit and address the importance of you as a client and how important it is for you to make decisions for yourself when you're thinking about how you want to deal with a problem that has to do with any type of sexual compulsivity. Some people come into therapy because they're identifying that there's a problem that they have with their relationships, work, and just even maybe in their own kind of self-esteem as it relates to themselves sexually, and they feel like things have gotten out of control. And so they seek out therapy to kind of help them better understand that, and maybe better manage the behaviors that they're struggling with. Others will come into therapy because they have a family member, typically a partner, who's really struggling with connecting, reconnecting, trying to build and foster a committed relationship with their partner because of sexual behavior. Regardless of the motivating factor, one of the things that I think is really important to look at is whether or is what you're looking to get out of the therapeutic process, and finding an approach that really works well and authentically with you. This also means that you might need to find a therapist who's willing to be kind of flexible with that too, because there's no one particular model or way of dealing with any problem, really. Um, so you have to really find something that kind of lands and makes sense to you and starts to resonate with you as you're moving through the process and trying to figure out what you want out of your life. And so in some of these debates about sex addiction, there is a little bit of a concern that I have that we could get too focused on the therapeutic opinions about whether or not, or how we can get too focused on how the problem should actually be labeled, rather than focusing on allowing clients to uncover and unpack and identify for themselves what they want to look like as a healthy sexual relationship with their partner, with themselves, and the boundaries that they identify. And so as you're kind of walking through this journey, recognizing that there is no one expert or group or organization who has all of the answers. We're uncovering and learning about all of mental health issues together, kind of at one time. However, and so it's a process and a journey for us as well. So if you find someone who seems kind of rigidly, holding their feet kind of, deep in concrete surrounding one particular, therapeutic modality or ideology, keep in mind that there are a lot of therapists who are also very open-minded about it and understand that it's a process, and part of the process is you unpacking what could help you work through it. And for some people, that label of sexual addiction does help them to identify, a community base and a place where they can get support in a particular way. And for others, that particular label, it doesn't help them, and they actually stay away from it, but still can make some, in improvements and work through it in a way that makes the most sense to them. And so, what I'm ultimately saying with that is that it's really important to figure out who you are in this process, and the therapist's role is to sort of reflect that back to you in a way that you can identify in your own story how you would identify with this issue that you're facing and what do you want as a result. And so, without getting into all of the dynamics of the actual debate around sexual addiction, I think because it can be kind of confusing as you're sifting through all the different materials and different opinions, those are the key pieces that you need to keep in mind. So thank you for listening.